this presentation will look at, in particular, charting. From your options section, move down through the various tabs to find dental chart. Remember, it's important when presenting an implant case that you show a regard for whole patient care. That means the periodontal status and the caries status will be looked at. So now we're considering the status and the health of the teeth, and we're going to be doing a dental charting. So first of all, what is the presenting situation as regards this upper right 8? Is it present or is it absent is the first thing we have to check. So this tooth is present, and then we're going to make a note of its current status. Has it got a filling in it? Is there any other type of problem with it? Or indeed, has it got a carious cavity? If so, what type of cavity is the tooth presenting with? Now, having marked the current situation regarding the tooth, we're now going to be showing the work that needs to be carried out. So again, we select here the type of treatment that we're considering to do. It's going to be an amalgam filling, it's an occlusal, and we place it. Now we have the current or existing situation plus our proposed treatment plan. Now we work through each tooth individually. In this case, we're saying that there's no tooth present, so we're going to update that, and the current chart is shown with a tooth absent. How are we going to treat that situation? Well, again, we go to our chart and we're intending to place an implant in this particular area. We move on to the upper right 6, and we're now going to update. Is this tooth present? Yes. What does it require? We're going to look in, and the current situation is it has an amalgam filling. It's an MOD amalgam filling. No treatment is required, so nothing is filled in the top chart. Now we move to the 5. And again, we're looking at this, and again the tooth is absent. We're updating the charting to show the current situation. We're intending to place a dental implant again in this area, and we can update the chart to show our dental implant. We can work our way through the arch, marking whether the tooth is present or absent, and then if it's present, what is its condition. So we're looking here, and in this particular case we're going to select that the tooth has a white filling. Now we can decide what type of white filling, and we've selected a composite, and we're selecting an MO composite filling in this tooth. It doesn't need replacement, there's no work required. So now we're going to the next tooth in the arch, and in this particular case we've decided that the tooth is cracked. We've selected crack, we've updated the tooth, and for the moment we haven't decided on what kind of treatment we're going to do for that area. And we're moving on to the lateral incisor now, and again the tooth is present. We're going to update that tooth with its current status, and in this particular case again we're deciding that it has a filling, a white filling, and in this particular occasion we're going to select a glass ionomer. And we can work through our teeth in this manner, selecting the present situation and what we're intending to do. In this situation we've decided to change from a cracked tooth to a different type of restoration, and we've decided to place an inlay. And now we select the type of inlay, and we can update and change our charting from a cracked tooth to an inlay. We can carry on working our way through the entire arch in a similar manner. In the case of the upper right central incisor, we've decided this has a hopeless prognosis, and we're going to be extracting it. So we can select extract and update. Now of course it may well be that we're intending to extract and place an implant, in which case change from extraction and place implant. Now eventually you'll end up working through the entire arches, upper and lower, and you have to confirm when all the work's done, and this will update the upper and lower charts accordingly, showing all the work that's been done to make your patient's mouth completely healthy.